Hey YouTube, what's up? My name is Ellie. I'm a transgender, non-binary person, and I've been on testosterone for the past 3 years. I am getting ready for top surgery. Link in the description below if you want to help me with the GoFundMe. I'm fundraising to be able to afford the surgery, and since I'm fundraising, I figured I should be putting content out there. I should be helping the community in my own way, which I want to do by sharing a little bit about what transition has been like for me, especially from the mental side. And I want to use this opportunity to talk a little bit about therapy during gender transition, which I think it could be extremely beneficial. So, the way this goes is I have started my transition 3 years, 9 months ago when I started taking testosterone. And when I set out, I basically went to my GP, to my general physician, family doctor in Hebrew, and I told them I wanted to transition, and they prescribed testosterone for me. And they just basically they didn't they were not gatekeepy in any way. They just took my word for it. Also, I had been presenting very masculine at the moment. I was a very butch lesbian, for lack of a better term. And I had a very androgynous appearance, and I think it really helped in convincing all the health professionals I've ever come across that I'm serious about my transition, because I really looked the part all throughout my way. And I was prescribed hormones exactly when and how I wanted them. And on the one side, it was easy and beautiful, and on the other side, I was never directed to a mental health clinician throughout my journey, which, is actually perfectly okay. I don't think that everybody needs a therapist to transition, and I definitely don't think that anybody needs a therapist's approval in order to go on hormones or to get top surgery or any of that stuff. So for me, I didn't want to go through top surgery in Israel, because in Israel, in order to get it funded by the state, you have to go through a gatekeeping committee. Like there's a committee that is made up of mostly cisgender professionals, health professionals, and they have to approve you for surgery, which I personally didn't want to go through because of two things. Firstly, because I disapprove of the premise that me, a mentally stable and capable adult who is capable of knowingly consenting to a procedure like surgery, that I would need someone's approval in order to do this. Like, the whole thing is ridiculous. My own voice is enough. I should be able to approve my own surgeries if I want them, just like any other elective surgery I could choose to have. So that's one thing. And the second thing is, on the flip side, I was pretty sure that if I had to go through a mental health provider, that that I wouldn't get it, that I wouldn't get approved. Like, I honestly thought that, which is ridiculous, because why wouldn't they approve me, right? So, there's a neighbor who's screaming. Okay, so I only actually started seeing a therapist this year, because with all the COVID and all the pandemic stuff, the quarantines and the rest of it, being away from my family here in Spain, and the divorce, and I'm also an immigrant, and my paperwork, which has not gone smoothly, it's been a struggle. I'm very privileged and lucky, and I have basically everything in life is going right for me, and I'm not complaining, not even in the slightest. I love my life, and I love the opportunities that have been given to me, and I'm trying to make the best of them. And I'm not saying that I have it harder than anybody else. The thing is, though, that I did go through like some genuine hardship on an emotional and mental level around my divorce, and I thought it was the right time to check in with a therapist. And the therapy that I have been given is actually courtesy of the autonomous community of Catalonia, which has its own specialized unit called Transit, where they have all the transgender healthcare sort of provided by the same people who are specialized in it, which is beautiful. And I had been able to receive 10 sessions of therapy with a gender therapist, as in she's a psychologist, highly qualified, and she specializes in gender treatment. Now, I'm not gonna say her name because I don't know that she wants this information out there, but I will say that she's a very good therapist and that I'm very, very lucky to have received her care. So when I came into therapy, I wanted to talk mainly about three things. I wanted to talk about like the shame that I had around transitioning, the fear that I had around surgery, and the fear that I had from other people acting violently towards me because I transitioned. So the fear of top surgery is the one thing that I want to focus on right now. So when I came in to talk about top surgery, I said, look, my biggest fear is that I'm making this shit up, like that I have been like sucked into some internet community and that I'm like completely bullshitting myself into thinking that I need this, like I fell in with the wrong crowd or something, and I'm like hallucinating all of this, and actually I would be fine without top surgery, like that it's crazy, like why would I want to cut my own flesh and all the rest of it. And while I was going on like this very long monologue about like how crazy it is to want surgery and what if I don't even want it and all the rest of it, she said like, okay, how long have you wanted top surgery? Like, and I said, ever since I knew it was an option. So she said, oh, and this is what a good therapist will do to you. They'll just like say one sentence that's gonna like smack you upside down the head, like, how long have you wanted this? Since I knew it was possible. And then she said, oh, then it seems pretty persistent, this madness of yours. Which is correct. Ever since I realized that I could get top surgery, it was a question of how. Like, how technically? Like, could I get a surgery that would reduce my breasts but would be considered as plastic surgery so I could have it and still pass as cisgender female? That was like the very initial phase of it. And then it was like, who do I have to lie to and what do I have to tell them in order for them to approve me for top surgery? That was like the second version. And then the third version was like, okay, I need this now. Like, how do I get this done? So there wasn't a lot of a thought about the why. My conscious brain did not go into the why. It went directly to the how, because should I or shouldn't I get top surgery? Like, for me, it wasn't even ever a real question, because I want this so deeply that the only way I can explain it is, to me, it feels like magic. So what I told my therapist at that moment was, okay, if you knew someone was giving out flying lessons, would you go and fly? And she said, yes, of course, I would love to fly. And I said, this is what top surgery is to me. It's like somebody is offering to me to fly, teach me how to fly. And then she says, do you listen to yourself? Like, are you listening to the words? You are explaining this. And top surgery feels like magic to you. You want it as badly as someone would have wanted to learn to fly. And yet you doubt yourself. And then she went on a very interesting explanation to say that really this is an outside voice that I have assimilated, and it seems like I don't doubt that voice, which tells me that top surgery could be crazy. Like, it is something that comes out from the outside world that has been put onto me by other people who don't feel the same way that I feel and don't have my experience, and that I have like interiorized that voice in a sense, and that I doubt myself, but I don't doubt my doubters, if that makes any sense. Like, okay, so the way this goes is like you have your own thoughts, like, oh, top surgery, how I want top surgery, and then comes another thought that says top surgery is crazy, and you don't look at this thought and ask it, okay, where did you come from? Where did I get this idea that top surgery is crazy, and what's behind it? You know, so you just go, oh, what if I am crazy? And you start doubting yourself and your own wants and needs and wishes. And she says, this is what happens when you step outside of the norm. That basically, as soon as you want or need something for your life that's not normative, in order to know if it's the right thing for you, you cannot look at what other people are saying and doing about it. Like, you have to look within you and realize how you feel about it and where it's coming from within you. Okay? And for me, this is kind of like difficult news, because oftentimes I don't know what I feel and what I want. And and this is where you have to do the work. Like, sit with yourself, try to understand what it is that you feel, where is that coming from, and to be honest with yourself. And that's very difficult, especially if you're a very repressed person like I am. Like, I don't even remember some of my most powerful memories. Like, I don't know if that even makes sense when I'm saying it like that, but I have a narrative version of this, of like some of the most important memories that ever happened to me, like with my parents, and things that were difficult or a little traumatizing maybe. I don't really remember them as a lived experience. I kind of remember them as a story, if that makes any sense. So that's one part of it. And the other part of it was the top surgery stuff. And the other part of it was that I was feeling around transitioning in general, like I would be less loved or less valuable as a person and as a professional if I transitioned. And we were speaking about that in therapy, and I said, when I went to Israel and visited my family and friends, I was shocked by how much they still loved and respected me, even though I was trans. And my therapist reflected to me that I used the phrase "even though," which implies that there is an assumption that is beneath that. And we worked on that together. And the thing is that I have like a false belief that transgender people are not worthy of love or not capable of being loved in the same way that cisgender people are. Like, that it is somehow harder to love a trans person, or that they will be less loved than they were before. And for me, that's a big thing, because I rarely feel loved as it is. And transitioning was something I did basically within my beliefs that I would lose love for it. My wife's love, for sure, because she was in a sense disapproving of the transition, and she wanted to stick to her lesbian identity, and for her it clashed with me transitioning. And I was pretty sure that my family was not going to be fully embracive. Like, they completely do accept me and support me, but setting out, I didn't think that was going to be the case. And surely I thought that as a transgender person, that I would not be respected as a health professional to the extent that I was before. I'm happy to say that that has nothing to do with reality. And as a transgender person, I am fully respected as a health professional. I am a physical therapist. I do specialize in sports physical therapy, and I am fully looked and treated as a professional of my field. There's even an element of male privilege that goes into that I am more listened to now than I was when I was female. But also, when I was female, I was a very young physical therapist. I was actually not even a full-fledged professional. I was a student, so it's kind of hard to speak on that. I don't want to go ahead and just stamp male privilege over that. Okay, and then the shitty part is that I did break up with my wife, and that my transitioning, I think, had something to do with it. But you know what? Part of it was when I transitioned that I realized that I was being more connected to myself and what I needed, and I could no longer be with somebody who was not attentive to my needs and didn't fully accept me and love me and need me to be who I really am. So for me, letting go of my ex-wife was also a step towards having healthier relationships. So that's something super important. Even though at the time it felt like I was choosing my beard over my wife, which sucked. Okay. So all of these thoughts and feelings that transgender people are somehow worth less on a professional level or going to be less loved, which is, as much as I hate it, something that is kind of like ingrained in my head. My therapist says that as soon as you step out of the norm, just like with top surgery, that doubting yourself and doubting your worth is something that happens. And to me, knowing that what I'm experiencing is actually a very common thing, and that basically anybody of any minority doing something against societal norms is going to feel that way, is really helpful, because when you sit down to think about it, it is a normal response to a shitty situation. And knowing that my brain and my emotional makeup are like functioning well and I'm responding normally to the circumstances is actually making me feel a lot more sane in a way. Like if you get a bruise on your knee and then after a couple of days the bruise goes down and you're walking normally, that's a normal process of healing, and it looks to an onlooker as though your system is functioning fine. So when you take the appropriate damage to a hurtful situation, that is actually good news. I mean, to me at least, the way I look at it. The way I look at it is like, okay, I strayed from the norm by transitioning, and then the world reacts to that in a certain way. Like, the world calls you crazy. People doubt you, people say dumb shit. And you end up feeling a little crazy for doing that. And it turns out that's the normal response. And I'm like, oh my God, this is beautiful. This is absolutely beautiful. So here too, the answer is going to be like, look within yourself and make sure that you're doing what you're doing because you want and you need to be doing it. And use yourself as your compass, And try to distinguish between your thoughts and feeling and what has been put on you by society, by the world. Okay. And the last thing that I want to touch on while we're here and while I'm basically repeating myself in a circle is shame about being wanted in relationships and all the rest of it, being desirable. So I wanted to open up in therapy that I didn't feel desirable, that I felt as if the women that I was attracted to were not going to want me, not going to want to be in relationships with me, and that basically who I tend to fall in love with will not ever reciprocate that, right? So this was brought on by me developing a crush recently, which I'm not going to name any names because I never do. But there is a person that I like, and I mean, it's a very butch woman, and she identifies as a lesbian, and she's only dated women, very feminine ones too, I am told, up until today. And I opened this up with my therapist, and I said, look, I really like this girl, you know, but she's a lesbian, and she's not going to date me because she's a lesbian, and I'm a dude. And then my therapist looked at me and she said, sweetie, where you're going, the labels are not helpful. She didn't actually call me sweetie, she called me cariño, which is kind of like sweetie, but in Spanish, but it's also like it's not a belittling term, it's just a nice term of endearment. And the point was that, you know, as we grow up, at least we get a little bit better with love, you know. And one of the things that we can do to really help ourselves get out of that teenage mindset is drop anything that's not helpful. And while labels like dude or girl or lesbian or cis or trans, like they might be very helpful for certain things and in different times, but when it comes to love, like what you have to understand is whoever is going to love you is going to love you. You know, whoever is going to be attracted to you is going to be attracted to you. And borders will be crossed whenever they need to be crossed, and you will connect with the people that you need to connect with. If you like someone, you know, it doesn't matter what and who you are. It matters how you connect with them and if they reciprocate that feeling. And if they don't, then you just move on to somebody who will want you. But just because someone is or isn't, by their own definition, one thing or another, doesn't mean that they're not going to be attracted to you. Which was a beautiful sentiment to hear. And I felt very, very, very encouraged by that. And I have to admit that that's true, because in the past, regardless of labels, I have been in relationships with people who from the get-go were not supposed to be into me. And if that happened before, why wouldn't it happen now, you know? And that was kind of like a hopeful note, you know? Please, whatever you do, don't encourage me to ask out the girl I like. It's a different situation. It's complicated right now. I'm not going to do it. But thank you for listening throughout this ramble in the sun. I had a good time. I hope you did too. Big hug to anybody that's out there, that's listening, that's sharing some of what I'm going through or has their own journey. I really hope that there is a system of support for you out there the way there is a system of support out here for me, because between my family, my therapist, and my friends, I am being looked after. And I really wish that upon anyone and everyone attempting to transition. Peace, love, and spring. Spring, finally. I hope you all have a beautiful spring. See you in the next one.